Clinton.
Omicron concerns that there has been a confirmed case of a student in Sydney. We don't know how this student got the virus. What do you know?
No, look, first of all, I have to say that the positive side is that we're not seeing what we saw earlier in the other variants. We're not seeing people suddenly being rushed to hospital. What we're seeing is people who either are asymptomatic or have very mild symptoms, generally. But of course, this is of concern to the extent that this is the first case that we know of that appears not to have had any travel history. So it would appear to be, at least until there's further investigation, it would appear that the case could well be an on New South Wales soil transmission. There are, I should say, since you've asked, there are 2 other students that we're currently, that Health, I shouldn't say we, Health, are currently investigating. They have had early indications of a dropout S gene, which is an early indication of a possible Omicron, and I'm expecting. Oh yes, sorry, that's yep. And I'm expecting that those results should be back later today, probably late this afternoon or early evening, and we'll know further. So it is a challenge. It's at a particular school in the southwest of Sydney, and the senior students this time of the year, it's convenient, so they've gone home, it's fine, and the others are the ones who we need to are obviously being tested, who are in the cohorts with the relevant students.
And no leads yet as to how it got across to Western Sydney?
No idea.
Is that a concern that community transmission is out of the bag now?
I think transmission is always a concern, but we also again need to just keep it in perspective at the moment that worldwide there's not a clarity around whether or not this particular variant is going to cause us anywhere near the problems that the earlier variants caused us. And what we always aimed to do right from the outset was to make sure that we had capacity in our hospitals if there were increasing numbers. You'd probably remember that almost 2 years ago now, we identified that we had more than any other state or territory ICU respirators, ventilators, about 500, and the health team and the government here went out, all out, and got the best part of 2,000. So we more than quadrupled our capacity in the ICUs. We also had health within the hospitals, and I'm sure it would have been happening here as well, but staff who were working in other areas were also asked to back in by learning how to work in an ICU. And the net result of that was that we're well placed if it does increase, but at the moment it's very early days. So I think my advice to the community is be cautious just the way you always have been, but don't anticipate necessarily a rapid growth. But let's just go cautiously and certainly listen to the continuing health messages of being cautious, and particularly if you have symptoms, go and get tested. I know in some situations that doesn't appear to have always happened.